Hello, everyone. Bob Graper here. We have got to shift gears to get my PowerPoint presentation going. So I'm going to share my screen. And that's what I want. Okay, so this is 2020. We've been doing seminars in Charlotte. I think we were the first people to do seminars in Charlotte back in the 90s, and been doing seminars to educate people, to tell them what is the real story about plastic surgery. Is it good? Is it bad? Who's it for? And it's been a great time. And this is our first Zoom one, thanks to COVID. So thanks to Debbie Williams and Heather, who have put this together. That's the building in the summertime. Certainly doesn't look like that now, but it's a freestanding office with accredited surgical facilities where we do all our cosmetic surgery. All the skincare gals are here. We have 4 skincare gals, and we have 3 nurse injectors for Botox and fillers. We do hair restoration. We do cool sculpting, so full service. We're going to talk. Dr. Harper did a fantastic job. He's an excellent speaker and really knows his material, but he's done body things. So he's given me the task of doing facial aging. And basically facial aging is wrinkles. It can be brown spots and red spots on the face. But how do you get wrinkles? And you get wrinkles from the genetics. You can pretty much look at your parents and say, you know, the things I got are from them. I know I look in the rearview mirror or the mirror and go, what's my father doing here? And so most of that is genetics, although you can get the chemical injury from smoking, you can get sun damage, and that's where a lot of us get the aging. And of course, sunscreen helps a lot, but just not being in the sun when you don't have to be in the sun. And if you are, you need a UVA and UVB protection on your sunscreen. And most are these days, certainly all the ones we have available in our skincare lines are UVA and UVB. Facial aging comes in basically 5 categories, I'll think. This one talks about atrophy, fat loss, loss of elasticity, but I think of it in terms of quality changes to the skin, quantity changes to the skin, fat distribution changes where you've got too much fat one place and not enough fat in another, which would be a volume problem, and then muscle laxity. And you want to address all of those for a comprehensive aging treatment. So what we do here is we make a diagnosis. We listen to what patients want and what their concerns are, and then we evaluate them, do a physical exam. We find out what things they need to rejuvenate themselves, what things they want to rejuvenate themselves, and we blend those 2 things to come up with a surgical plan and a skincare plan, maybe a filler plan, Botox, whatever is needed. So facial aging really isn't rocket scientist type stuff. It is predictable. You know, in your 30s, you start getting those crow's feet, and those, as everybody knows, are out in here. The nasolabial fold is in here. By 40, you start to get the forehead wrinkles. 50, you start to get the jowling down here, the transverse folds, the up and down folds that Botox fixes. Thinning facial skin, decreased fat out here. We used to have full zygoma. Now it's a thinned area, and all of those can be treated effectively. So what do you do about it? You know, having good genes is the best thing, but you really can't change that much. So if you look at your parents and they look good, do what they did. But if your parents don't look so great, what could you improve on? Could you be out in the sun less, or could you use more hats and sunscreen? If they were smokers, don't smoke. Smoking is really toxic to your body and certainly your skin, and makes aging more rapid. The skincare gals, of which we have 4 of them, have individualized strategies for each patient, but overall, you want to have a retinol component to your treatment. You want to have a peptide growth hormone treatment to your skin, and you want to have an antioxidant. And you can manipulate things from there. but that's the basis. And I'd look for a product that does all of that in one setting, maybe the antioxidant and the peptide component in one product, a retinol at night, and then a sunscreen for whenever you're out in the sun. And that helps thicken the skin. It turns the wrinkles. It's harder to wrinkle thick skin than it is thin skin. So that's why you want thicker skin. And that's what Retin-A helps with, or retinol, which has 85% of the benefits of Retin-A, but only 5% of the side effects that you may have all experienced. The antioxidants help with breaking down the environmental toxins that will damage your skin. And then, retinol will also, it'll thicken the skin, but it will also have the cells turn over faster, so you don't have an old beat up skin cell sitting on your skin that feels really rough and can be replaced by a skin cell that is newer, younger, softer, and your skin feels better. And it looks more like, a piece of furniture that has 10 coats of varnish on it rather than one. So your skin gets depth to it. And the estheticians go over all of that. So we're going to start talking about what I think is the fun stuff, and that's the rejuvenation of the face. And we're going to do it in a stepwise fashion where we're going to do the simplest things first and work our way up in a ladder of complexity and addressing more diagnosis. So with liposuction of the neck, presumably the diagnosis is that the skin is good, the muscles are good, and the only problem is that there's too much fat in the neck. And if that's the case, we make an incision under the chin and the crease. It's about 1/4 of an inch, and we just suction the fat out of the neck. And you can see her cervical mental angle, which is this angle right here, is very blunted. It's not a straight line, but it certainly isn't 90 degree. She's got a little bit of jowling going on there, which is muscle, and she's probably got a little extra skin, but she chose to do liposuction alone, and she has a very nice result. The jowl is not gone because liposuction doesn't tighten loose muscle, so it remains, and you can see a little bit of extra skin because liposuction doesn't tighten skin, but overall a very nice result. Moving up the ladder of complexity, a myeloplasty is something that will tighten muscle and remove fat both above and below the muscle, but still won't address the skin. So here's a lady also with that more obtuse cervical mental angle, not at 90 degrees, but here she is afterwards, and it's much more 90 degrees because we've taken the fat out above and below the muscle, and we've tightened that muscle up like a sling underneath her chin. And unlike these people in Hollywood, which seem to come out looking strange and operated on, she looks very natural, and you can't even see her incision. And these pictures are typically taken at 6 weeks from surgery. So neck lift, the next step up, where they may have extra neck fat, they may have extra neck skin, and they have muscle banding. We do that same procedure as a myeloplasty, where we make about an inch incision in the crease under your chin. We do the same things with the myeloplasty, but then we add an incision that starts right here, follows that bump here called the tragus, hugs the ear-face junction, goes on the back side of the ear, and then either into the hairline or down the hairline, depending on whether we think there's enough skin to raise the hairline. And we tighten the muscle, we take the fat out, but through the incision back here, we'll take that muscle that we made a sling out of and pull it tight like that trampoline. That'll pull extra skin that will trim off and tailor, and you can see her result at 6 weeks after surgery. You can't see her incision because she's able to conceal it easily with her hair. Men have a harder time doing that, but ladies can use their hair to camouflage things. And a nice natural result. She looks younger, she maybe looks more fit, and certainly looks natural. So facelift is the exact same thing as a neck lift, it just adds the face. So in our parlance, in this office, a neck lift is it treats everything below the jawline. A facelift treats everything from this bony cheekbone down to include the neck area as well. So for here, you can see that her jaw and her face has gotten a little bit square. She's got some folds here. The neck looks a little loose. And from the side, you can see that she had the jowls, she had the extra skin, a little extra fat, and all of that has been cleaned up by our procedure. There's her incision that actually, unlike a neck lift, the facelift incision starts up in her hair, but then is exactly the same incision as the neck lift. And all of her aging deformities or diagnoses have been treated with a scar that is hard to see and a very natural result. Here's another lady who we've done multiple procedures on, which is common, like Dr. Harper talked about. We'll frequently do eyes or brow with a facelift, but this is demonstrating that her eyes have been done along with her facelift. You can see that the squaring, more oval here, the extra skin gone, her eyes improved, and from the side, you know, she's rejuvenated. Here she looks like somebody's mom, and here she looks like somebody's date. And again, you can't see her incision because her hair is hidden, but down here you can't see it either. So a very nice result. There are some minimally invasive techniques for treating skin laxity and melting fat, and one of them is called ThermiTite. This, you know, the surgery is obviously an invasive technique. ThermiTite is a minimally invasive technique, meaning there are only puncture wounds. A non-invasive technique would be no incisions or puncture wounds at all. And ThermiTite is a reasonable approach for people who have early aging changes to allow the skin to tighten up and to melt some of the fat. I've been disappointed with results on people who need more. They're better off doing neck lifts or facelifts. But for people who are just beginning to have aging changes, this may be an option for them. And you can see some of those results here. Okay, and I should probably go and see if anybody's got any questions. Maybe the ladies will help me, but I don't see the chat room questions, so I'm going to keep talking. So next we're going to do eyelids and brow, and they go together because if the brow needs to be in the proper position, and we again evaluate extra eyelid skin and fat and muscle. And Dr. Harper's coming in here to help me.
So they'll start coming up in there.
Okay,
Keep going.
good. So so far I've been answering questions. So brow lifts are procedures done to lift the brows. The brows should be arched above the bony rim. They should be arched about 2/3 of the distance from the inside of the brow to the outside. It'll help remove forehead wrinkles, and it will take skin out of the upper eyelid. So it does a lot of things. And a blepharoplasty is the fancy word for just treating the skin, muscle, and fat of the upper and lower lids. And it also turns out that the brow lift will have not only a rejuvenating effect and age, but it also makes a person look more feminine if you're doing it on a woman. And of course, you have to be careful on a man because you don't want to make them look more feminine. But it also makes them change the mood or the impression they give off. And I'll show you a perfect example of that. So these are some smiley faces that everything about these is the same except for the brow position. And here, this one looks sort of tired. This one looks sort of angry or mischievous. This one looks sort of tired or sad. This one looks happy and alert. Now look at that in a real patient. Look how flat her brows are, or even down slanting. And her brows are below the bony rim right here. She's got all this extra upper eyelid skin, and she's got the puffiness under her eyes, which is just visible orbital fat that's there to cushion the eyeball in that bony orbit. And it's not that you have too much fat in your eyes, it's that the wall holding it back is not flat anymore, it's bowed, and we see the fat through that bowed structure. So here she is after a brow lift. She's had her upper eyelids done, the lower eyelids done. The incisions are very difficult to see. And she looks awake and alert and rejuvenated. And she was a school teacher, and she came in saying, you know, I feel great, I love my job, but people keep asking me, are you tired? Are you sick? Do you not feel good? And she said, I feel fine. I just don't look like I feel fine. So the surgery helped her dramatically. Here's a lady who had her brows done. She had them lifted, and we did not do anything to her eyes. This is a 6-week picture, and I think her eyelids still look a little puffy. That looks a little swollen to me compared to that, but her brow lift incisions are up here and here. Her brows are up. These lines are greatly improved. Her eyelids are improved, and it's a nice result with a natural look. Here's another lady with a brow lift. And you can see this is the older technique where we made an incision all the way across the brow. Oops, I went too far. And you see what it did to her eyes, what it did to her brow. And we rarely use this incision anymore, but it shows a nice result from what a brow lift can do. Here's a lady who had her lower eyelids done. You can see the puffiness here, the circles that have all been taken care of. Incisions are very difficult to see. So again, that Hollywood problem of looking distorted and unnatural just isn't the case in Charlotte, North Carolina. I don't even know how they do that in Hollywood, but they seem to do it consistently. Here's upper and lower eyelids. We hide the upper lid incision in the crease. The lower lid incision is right below the lash line. The fat's addressed, extra skin, and tightening the muscle. This takes about an hour and a half to do. You go home, put ice on your eyes, sleep with your head up, stay away from salty foods as we do this kind of thing for all of our facial procedures to make the healing process faster and smoother with less bruising. And it works nicely. I have a question now. Is there much difference between a mini lift and a facelift? You know, every office will be different and what they call a mini lift versus what they call a facelift. For us, a mini lift would only be treating from here to the jawline, whereas a facelift is treating here all the way down to the clavicles, and a neck lift would be from the jawline to the clavicles. So a mini lift is for somebody whose neck looks good, but they're having problems with the jowl, they're having problems with the fold here, and that will be appropriately taken care of with a mini lift. I hope that answers the question. Recovery time from facelifts or neck lifts, you know, really, you know, you'll look good in 2 or 3 days. Our bruising really is not very much. We use a new spray called Artis that is a plasmin activator, and that helps coagulate and stick the tissue. So the swelling is much less, the bruising is much less. And I really think if you're careful, you can be out in public, especially ladies who can hide incisions with their hair, in a week. Now, I don't want you out dancing, but a controlled social situation with friends, not a problem in a week for the vast majority of people. Can you do a brow lift? Let's see, moving quickly. Puffy eyes under. So it says, if I wait too long to correct this, is it less likely to be completely fixed? No, you can fix that at any time. And generally it lasts quite a long time. Every now and then we'll see some previous brow or blepharoplasties that the puffiness has come back. And, you know, usually it's from patients that aren't mine, but I saw one recently that had a really bad case 6 or 7 years ago, and it's recurred a little bit, and we're going to go fix that, but it's a very solid procedure that has long-lasting results. Price range on brow lift, again, a great question for Carly Gibson, our surgery coordinator. She yells at me if I give prices out. I would say 5, 6, 7,000, but she'll yell at me as soon as I say that, because if I'm high, she yells, and if I'm low, she yells, but it's something in that range. So here's a guy, had upper and lowers done, same kind of natural results. This stuff, he's still got wrinkles. That's an example of quality issues. There's not too much skin there as there was here. What's left is the appropriate amount of skin, and now we need to do a chemical peel in that area to improve the quality. And I would liken that to a quantity problem is when you've lost 10 pounds and your slacks don't fit anymore and you take them to the tailor to remove the extra quantity of fabric. But if you got mustard stains on those pants, you got to take them to the dry cleaner to get the quality of the fabric improved. So similarly in surgery, the blepharoplasty will take away the quantity of fat and skin and extra muscle, and a chemical peel will deal with the quality. Here's a lady who is getting her eyelids done and a TCA chemical peel. So we did the upper and lower eyelids, and so the skin of the quantity is gone, but the quality had to be addressed with a peel. And you can see the wrinkles on her face, on her upper lip, the chin, the cheeks, the eyelids have all been resolved here. Natural appearance, scars are impossible to see, looks like herself, but just better. And that's what we do. Rhinoplasty. Rhinoplasty is just changing the nose, and you can see some well-known stars that start with one nose and look like another. And rhinoplasty, like brow lifts, a procedure that can impart femininity. If you have a bump on your nose, it does make you look more masculine, where a guy might look good because it makes him look more masculine. That same bump makes a woman look less feminine. And so we do a lot of that type of surgery to get that bump to go away. So unlike skin, muscle, and fat that we've been talking about before, now we're talking about skin, cartilage, and bone. And we change the shape of the cartilage and change the shape of the bone like you would change the shape of tent poles to change the look of a tent. That changes the shape of the nose. And rhinoplasty can be covered under insurance if you have breathing problems. So if your nose looks funny, but you're breathing fine, insurance isn't going to cover it. But if your nose looks fine and you're breathing poorly, insurance will cover that. And a lot of people will come in and say, I'm not breathing great, wink, wink, wink. Yeah, we don't really do that. That's called fraud. And if you lie to the insurance company, you'll lie to a patient, and we don't do that. So let's show you some examples of rhinoplasty where this is a perfectly fine nose. I would call it more of a Roman nose. And we've just taken that bump down and given her a concavity that definitely looks more feminine. The incision is a little incision right here that looks fantastic very early on, and the rest of the incisions are up inside the nose that you don't see at all. Here's a lady who we did a facial analysis, as we do on everyone, where the distance from here to here should equal the distance from here to here. That's the lower face to the mid face. The mid face distance should be, well, I should say better, the distance, the length of the nose should be 2/3 of the mid face distance. The projection of the nose should be 2/3 of the length of the nose, which is 2/3 of the length of the mid face. And that's Farkas's golden rule. And we look at it in those dimensions for vertical, but we also look in horizontal dimensions. Is her chin far enough and out? So what we've done here is take her bump down and bring her chin out to give her a much more balanced profile. And we're able to do this on every patient, and computer imaging helps dramatically to show a patient what's reasonable and to give her options on how much straightness versus concavity she wants, how much to bring the chin out she wants, and that allows us to make a surgical plan and also get on the same page so we're both know what each other wants and intends to do. Can you do brow lift without cutting at the hairline? You can cut it behind the hairline, but that will raise your hairline. And if you have a very low hairline, that's not a problem. But if your hairline's more than 6 centimeters, most ladies don't want a bigger forehead. So that incision can be put right at the hairline, and the endoscopic ones heal fantastic. The old coronal approaches, incision wasn't as reliable, but I would have no concerns about doing the endoscopic brow hairline incision. Again, here's a nose that we took the bump away after that facial analysis. Natural, normal, looks better. And again, talking about chins, she's got sort of a rounded face through incision, the same incision we used to do the myeloplasty. We put a chin implant in. It's a lot like a breast implant. It's made out of that same silastic, very natural, and it just improves the facial symmetry. Is there a way to reduce the width of a nose using non-surgical means? You can inject filler on the dorsum of the nose to give the impression that your nose is thinner. That precludes that you don't already have a bump on your nose, and that adding the filler won't give you a bump. And you also have to be very careful with filler on a nose, because there have been reported cases where the filler gets into the veins and arteries of the nose that communicate with the ophthalmic artery to give blindness. So it can be done, but it is not quite as straightforward as you might be led to believe in some of the lay literature. Here's a guy who didn't like his chin, so we deepened the cervical mental angle with a myeloplasty and used the same incision to put a chin implant in. His facial balance is much better, and that gave him the confidence to shave off a mustache he's had for 30 years, which I thought was very interesting. Now we're going to talk, we've seen some peels. We're going to talk about laser resurfacing and peels. Laser resurfacing is another way to remove the outside layers of epidermis and dermis. And what we're trying to do is remove all this damaged epidermis, which is the outside of the skin that you can touch and see, and the underlying dermis that makes the epidermis. So we want to get down below the skin damage, down below the wrinkle, and create new collagen and new elastic fibers and thicken the skin and remove all those wrinkles. So here's a lady that has had a laser resurfacing. She's also had a facelift, as you'll see from the side. The front, you can't see the incisions, just like you didn't on the original facelift pictures. And from the side, oh, I don't have a side picture. From the side, you can show the same great facelift results, and her skin quality is improved. So here, wrinkles on the cheeks, on the upper lip, around the eyes, all improved with a chemical peel. Chemical peel and laser resurfacing, again, do the same thing, except one does it through chemical energy, the other does it through photons of light energy. We tend to do mostly chemical peels because we can do them cheaper. We didn't have to buy a $150,000 laser whose cost we have to pass on to our patients. So with a chemical peel, that the ingredients are much cheaper and the results are the same, we're able to get the same effect with much less cost. We tend to do those in the winter because we don't want you to have sun before or after, and there's no other way to do it. You can do it with a laser or chemical peel or even dermabrasion, but that's the only way to do it. How long will results last from chemical peel and lasers? I think they're better forever, but we get wrinkles because of our genetics. We get wrinkles because we move our muscle and our face in the same exact every time way when you smile or pucker. So if you can keep your skin thicker with daily skin care and staying out of the sun and using sunscreen when you are in the sun, you can prolong your results. But time marches on. Facelifts are better forever, but they don't stop the clock. They reset it and it keeps ticking. And the same is true with chemical peel. So, you do a chemical peel when you're 55 and at 75, could you need another one? Yes. But it's also true that at 75, after a facelift at 55, you will look better than you would have looked. And people will go, wow, you look great for 75, even though you could still use another one. I hope that makes sense. How painful is chemical peel? Shockingly not. It is painful if you are awake while we're doing it, but we put patients to sleep to do it. The only exception to that is if you're doing just the perioral area. And if that's the case, we can put a dental block in here, 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 and here with local anesthetic, numbs up the whole area easily, do the peel in 10 or 15 minutes and you go home. Doing that over the whole face is a lot of needle injections, and that's more traumatic than the peel. So we tend to put those people to sleep. So when you wake up, it's not tender because we have numbing cream on and we give you medications during the anesthesia. As the numbing cream can wear off, it does become hot. It just feels like a hot sunburn. And I can tell you this from years of patients telling me how it works, and my wife, who's had one, that about 8 o'clock that night, it's like you flip a light switch and it just stops. And then it becomes no tenderness at all. And I've got pictures of patients that are smiling and giving me the thumbs up and kind of playful expression, and their face looks terrible because it looks like a burn. By the way, we call it a chemical peel because chemical burn isn't good marketing, but that's really what it is. It's a controlled burn to remove all those wrinkles, but it works fantastic. Another example, look at the quality of her skin there versus here, dramatically better. And there's only one way to do it. So you've heard from Dr. Harper, you've heard from me about facial procedures, brow lifts, eyelids, faces, necks. How do you know if this is a thing that you want to do? Well, you need to have a real problem. I mean, you can't come in with a perfect nose and go, hey, I want to fix my nose. We're not going to help you. We're going to tell you why your nose is great and send you on your way. And you can have a real problem, but your twin sister has the exact same nose or the exact same eyelids, and it bothers you and it doesn't bother her, where you should consider doing it. She perhaps not. You've got to be concerned about the problem. Your sister's not concerned. She should forget it. You can keep going forward and exploring. There has to be a good known surgical procedure that is safe and reliable and will predictably improve the problem. You have to be in good medical condition. You can't be on death's doorstep and go out and have cosmetic surgery. That makes no sense. And because we do things in our facility as an outpatient, we get a medical clearance from your doctor, we get some simple blood work and an EKG. And we do that on everybody over 50 or at any age if you have medical conditions. You got to have safe results. We're not doing anything if it isn't safe. It needs to be affordable and it needs to be private. And if all of those things are true, this is a very reasonable thing to pursue and find out more about. Facial aging, facial rejuvenation, body contouring, breast augmentation, all these things work great, which both Dr. Harper and I do both the facial things and the body things. We are board certified by the American Board of Plastic Surgery. We're both members of the American Society of Surgery and the Aesthetic Society, which require higher training in aesthetic surgery. This is kind of our goal. We end up like raisins and we want to really be grapes. And we appreciate you coming tonight. The inaugural version of our cosmetic surgery seminars. That's our motto: the safety, honesty, predictability, and privacy. We try to do those and do those every time. Any questions? Recovery time on chemical peels. We want the peel to be healed between 7 and 10 days. If you've got serious wrinkles like those last patients I showed, if it heals before that, it'll be improved, but the wrinkles will probably, some of them will still be there. If you go past 10 to 14 days, we start worrying about replacing a wrinkle with a full thickness burn scar. So we would rather do a peel twice than we would do it once too deep. So we try to hit that nice sweet spot where it's deep enough to fix the problem, but not too deep to cause any kind of scarring. Okay, I think.
So I would have you put a plug in for everybody.
Okay, let's put a plug in.
I didn't know if you mentioned about laser hair removal, or the system that we have, or the RF microneedling machine.
Okay, Dr. Harper's joined me in here. We've got two new machines. Come on in here.
Yeah. So I'm in here now too.
So RF microneedling is the same thing as microneedling. If y'all have heard or knew about that, it's puncturing your skin with little needles that actually create a regenerative process to create more collagen and elastic fibers. And it turns out if you add electricity to that, it adds heat, and that heat causes even more of that same rejuvenation. We do it under what's called Pronox anesthesia, meaning you're breathing nitrous oxide, kind of fun. And it's very comfortable. And Debbie Williams, one of our marketing director, has done it. We've got it in the last month, and we're probably already done 20 patients. So it's already very popular. Dr. Harper, you want to talk about the laser hair removal?
Yeah, I can. And just also know that the radio frequency microneedling can be done anywhere on the body, right? So it's not just the neck. That's kind of what it was typically made for. But then they saw such great kind of results that they made a different headpiece on it that treats a larger surface area. And I've had patients that have done their tummies that didn't need a tummy tuck, but just wanted their skin tight in there. They've also done underneath their arms for arm sagging. They've done thighs, they've done anterior knees, all these kind of areas where we didn't want to ever make an incision if we didn't need to. This has been a great modality to help with that. We've got 4 estheticians that are doing a great job. And you know, we did a lot of legwork on this. Dr. Graper and I had a lot of meetings about it. We tried out multiple different machines, and we went with the one that we thought kind of fit our practice philosophy the best. So we're excited about it.
And
yeah,
I actually did it just before the seminar. I'm a little furry, and I've had laser hair removal in the past, and the treatment lasted about 15 seconds because it was incredibly painful. That was 10, 15 years ago.
Yeah.
And so I kind of went, you know, I don't think about this. Well, I just had it, and it was nothing, you know, slight areas of pins and needles, but mostly kind of like a hot stone massage. So I've changed my tune. I'm excited for it.
Yeah, and that's, you know, the laser hair removal system that we got, we can honestly say it's painless. And that was never an issue before. So, you know, the other machines, the other modalities, the laser modalities that have been used prior to this kind of machine's inception and the newer technology, the reason why they didn't work is because patients wouldn't do it because it hurt like crazy. It took forever because you were kind of individually like firing a little laser on each hair follicle. So if you did, you know, Dr. Graper's back, for instance, that would take a really long time. And so it's not fun for the person performing it. It's not fun for the person getting it either. So people wouldn't come back for their second, third, fourth treatments. And that's part of the whole prescription here. I mean, as far as laser hair removal goes, you have to do it for the life cycle of a hair follicle or it will grow back. So, you're coming in every 4 weeks for kind of, 4 to 6 cycles, depending upon how coarse your hair is, what color your hair is. But it can be done anywhere. And this new machine, we've had people that have done their bikini lines in a matter of a couple minutes, armpits in a couple of minutes.
Mustache?
Yeah, mustache, entire backs, chins,
Seconds.
nipples, any of these places that you just have you have unwanted hair can be addressed really in no time with no downtime and can be done throughout the year on any skin type. So it doesn't matter if you're darker skinned, lighter skinned, it works miraculously. You can do it through the summer because now the hair follicle is absorbing all of this energy. It used to be that the hair follicle absorbed 60, 70% and 30 to 40 got scattered within the skin. So if you went out in the sunlight after these treatments for a week, you would really risk burning your skin to the point of problems and sometimes permanent problems. And now, 99.7% of that energy is being absorbed in the hair follicle. There's no dispersion in your skin. You probably don't want to go directly to the tanning bed,
No.
but I mean, you certainly can go out the next day or 2 days later and get out in the sun with sunscreen. We're plastic surgeons, so we're not going to tell you not to wear sunscreen, but there's no downtime, there's no pain. It takes no time. I mean, this is really,
It's a game changer.
It's a game changer. It's a total game changer. And again, just like the RF microneedling machine, we spent a lot of time, a lot of effort in making sure that we were going to be able to provide our patients with the best possible outcome, the best possible experience, because, ultimately it's the reputation of the practice that Dr. Graper has developed over his 25 years here in Charlotte. And hopefully I am with the 8 that I've been here. So we're really excited about these modalities. They're different. We need to add it to our PowerPoint presentation, but we also have a gal that's come in that's doing PRP for hair treatments, right? I've kind of let the COVID hair grow right now, but I also got PRP treatments to help thicken some areas that had been thinning.
Yeah, I've been thinking about that myself.
And men and women are getting it alike. I mean, it's not just men that lose their hair. So these PRP treatments are great. This lady that's doing our hair restoration also does hair transplantation, hair grafting, and gets really beautiful results. So that's something new that we're kind of offering now at Graper Harper Cosmetic Surgery too. So there's some questions. Yes, it is PRP. Platelet-rich plasma is what it's called. And it's really just kind of shown to change the molecular capabilities of the skin where there's thinning, and is almost just like giving this big, huge boosted vitamin to your hair follicles. And so you'll start to see little hair sprout up. It's a series of 3 treatments separated by about a month as well. And then it's nice to kind of do this maintenance, maybe once a year, come in for some PRP treatment for that area as well. It's typically combined with either a topical modality or a pill form to kind of also help promote hair growth. But the PRP is a huge adjunct to that and really kind of kickstarts things. So pretty wonderful.
Another question was, does laser hair removal get gray hair? No, it doesn't. It gets black hair, brown hair, but you have to have that pigment in the hair is the target of the laser energy, and that pigment will absorb the energy and damage your hair follicle. So if you have a blonde or gray hair, it just doesn't absorb the energy, so it doesn't work.
And then will it help to hide the surgical line from a brow lift? I'm assuming you're saying if the brow lift is within the hairline, and the answer would be yes. I mean, certainly it would help kind of bolster the hair follicles around that incision line. If the incision line's kind of gone through and cut the hair follicle at that area, probably it'd be hard to just kind of let it regenerate through the scar, but certainly around it, it would help with a lot of that. Yeah, I agree. It's awesome. It's great.
Well, in brow lifts, now that we use endoscopic techniques,
Yeah.
that hairline incision, it just isn't an issue. It doesn't come up. You can use what they call trichophilic incisions where the hair will grow back through the incision. it just is a non-issue. There are very few problems with brow scars now that it's endoscopic and they're much smaller incisions.
Right. Let me make sure that we don't have any questions up above that gray hair question. Will it get gray hair?
Cool.
I think that's probably it. All
All
right,
right.
awesome. All right, thanks,
Enjoyed
guys.
it. Thanks for coming.
Yep.